Hello guys, now we shall be discussing regarding the larynx. Okay, so first important point which you need to know regarding the larynx is that larynx lies in the midline of your neck. Larynx lies in the midline of your neck. Okay, what is the second important thing? Second important thing is that larynx extends all the way from the roof of the tongue till the trachea. It extends from roof of tongue till the trachea. Okay, roof of the tongue till the trachea. So this is how the larynx will extend. Second important thing, if you look at the male adult as well as the female adult, from which vertebral level till which vertebral level is the larynx present? For example, if you look at a male adult, okay, the larynx ranges all the way from C3 till C6. Okay, in the same way, if you look at a female adult, larynx ranges all the way from C1 to C4. Not only that, even in children also the larynx ranges from C1 to C4. Right, now if you look at the size of the larynx in the males and in the females, the size of the larynx is different. Okay, so if you look at the size in the males as well as in the females, okay, so in the males the size of the larynx is around 44 mm, whereas in the females the size of the larynx is around 36 mm. Okay, so these are the two important differences which you need to know. So this picture, if you can see here, so this is the entire picture of your larynx. Okay, so this picture is a picture of your larynx. So can I tell that larynx is having some cartilages, right? So these cartilages of the larynx, right, are responsible for the voice production. Now we will understand these cartilages when we look at the internal cavity of the larynx. So whatever you can see right now, this is the external cavity, not cavity, this is the external surface. So this cavity which you can see inside, this is called as the internal cavity, internal surface or the internal cavity of the larynx. Okay, so this internal cavity of the larynx, is divided into three most important portions. What are these three most important portions? The center part is called as glottis. Above the glottis, that region is, I will show it to you in the picture. Above the glottis is called as the supraglottis, and below the glottis is called as a subglottis. So what are the things we have got? We have got glottis, we have got supraglottis, and we have got the subglottis. Right, if you look at this picture, this here we have got this cavity called as a nasal cavity, okay, oral cavity. So behind the nasal cavity, this particular pharynx which you see, this is called as your nasopharynx. Okay, next, this is the posterior portion is the esophagus, anterior portion is your trachea. If you go above the trachea, there you see this particular thing called as glottis, right? Above the glottis, what is the region? That is called as supraglottis. Below the glottis, what is the region? That is called as subglottis. So supraglottis, glottis and subglottis, three of them together you call them as larynx. Okay, three of them together you call them as larynx. Clear? So this is what I was telling you. The internal cavity of the larynx is divided into three: supraglottis, glottis as well as subglottis. To discuss in much more detail where supraglottis is present, where glottis and where subglottis is present, this picture will help. For example, if you look at supraglottis, what are the different structures that are present? Supraglottis ranges all the way from the inferior surface of the epiglottis. Where is epiglottis? See, for example, let me hide these parts so that you will understand where epiglottis is. Let me hide this part over here. Right, now look at the picture now. Where is epiglottis? See, this part over here is called as your epiglottis. So this particular structure over here is epiglottis. Okay, now what is this picture actually? Right, this is a picture of the internal cavity of the larynx, right? So when you are taking a coronal section like this, you divide your body into anterior and posterior part, right? So when I'm cutting my body in this way, when the axe passes like this, when I'm cutting my body like this, so these are the structures which you see over there. So if you look at the epiglottis, inferior surface of the epiglottis. Inferior surface of the epiglottis is this one. So all the way from the inferior surface of the epiglottis till the vestibular folds. Where are these vestibular folds? See, these folds which you can see on either side, right? You see these folds like this. These folds are called as vestibular folds. So till the vestibular folds. Vestibular folds are also called as your false vocal cords. Okay. So from the inferior surface of the epiglottis till the vestibular folds, that is the supraglottis. So supraglottis is all the way ranging from, this is supraglottis. Supraglottis is all the way ranging from inferior surface of epiglottis, inferior surface of the epiglottis till where? Till the vestibular folds. Inferior surface of the epiglottis till the vestibular folds. So these vestibular folds are nothing but called as your false vocal cords. These are nothing but called as your false vocal cords. So these structures which you can see over here comprises of your supraglottis. Okay. Next, what is glottis? You see this opening over here, this narrow opening, this small opening, right? So this small opening over here is called as glottis, right? Now within this, actually let me draw it here so that it would be clear. Right. You see this thing? So here, exactly this part, see, from here all the way till here, this part is called as glottis. But in the glottis you have got two folds. So this is fold number 1 and fold number 2. These two folds are called as true vocal cords. True vocal cords. These folds are called as true vocal cords. See here, see this fold over here, this one, this blue color fold and this blue color fold, you see this fold. These folds are called as true vocal cords. And in between two folds you see this narrow gap. This narrow gap in between two folds is called as rima glottidis. This is called as your rima glottidis. Okay, that area is called as rima glottidis. Now this is a picture which you are looking from the front, right? When I'm cutting in this way and if you are looking from the front. For example, if you put a laryngoscope inside and looking from the top, right? From the top, this is how it looks. From the top, this is your epiglottis, vocal folds. These vocal folds are called as true vocal folds. And this opening is called as what? Rima glottidis. This opening is called as rima glottidis. Then where are the false vocal cords? These vestibular folds are called as false vocal cords. Okay. So this is how the structure is present. So we discussed about what is this? Supraglottis. We also discussed about glottis. Now let us discuss about the subglottis. Where is this subglottis? Where is this subglottis present? Just look at the picture. Where is the subglottis present? Subglottis is present all the way from the inferior border of glottis, right? Inferior border of glottis till the inferior border of the cricoid cartilage. You see this area, this area is called as a subglottis. Inferior border of the glottis till the inferior border of the cricoid. Inferior border of glottis to the inferior border of cricoid. So this is the subglottis. Now if you look at the epithelium, guys, the entire larynx is lined by pseudostratified ciliated columnar epithelium except the vocal cords. Okay, pseudostratified ciliated columnar epithelium. So the entire larynx is lined by what? Pseudostratified ciliated columnar epithelium except the vocal cords. Vocal cords, in the sense that we have got two types of vocal cords. One is called as false, which are also called as vestibular folds, and next we have got is a true vocal cords that are surrounding your glottis, right? So true vocal cords are not lined by pseudostratified ciliated columnar epithelium, they are lined by stratified squamous epithelium. So except true vocal cords, they are lined by stratified squamous epithelium, stratified squamous epithelium, stratified squamous epithelium. Okay. Now let us look what are the arteries that are supplying the larynx. It is very easy. There are two different types of arteries that are supplying the larynx. What are these two different types of arteries? One is called as superior laryngeal artery, and the other one is called as the inferior laryngeal artery. And superior laryngeal artery is a branch of what? Superior thyroid artery. It is a branch of superior thyroid artery, whereas inferior laryngeal artery is a branch of inferior thyroid artery. So we have got two different types of arteries, superior laryngeal artery as well as inferior laryngeal artery. Superior laryngeal artery is a branch of superior thyroid artery and inferior laryngeal artery is a branch of inferior thyroid artery. Now coming to the veins are also very simple. There are two different veins. One is called a superior laryngeal vein and inferior laryngeal vein. Superior and inferior laryngeal vein. So what are the things that we just have discussed regarding this, guys? We discussed that there is something called as larynx and voice box or voice box. In the adults, it ranges all the way from C3 to C6. In the females as well as children, C1 to C4. Size, the males it is 44, females it is 36 mm, right? Next important thing is that this is the internal cavity of the larynx is divided into subglottis, glottis and supraglottis. Okay, three important things. Above the glottis we have got supraglottis, below the glottis we have got the subglottis. So here, where is supraglottis? Supraglottis ranges all the way from the inferior surface of the epiglottis till the inferior border of the vestibular folds. Okay, you see these two folds over here. Let me write it down. These folds over here are called as your vestibular folds. And what are these vestibular folds? Vestibular folds are nothing but called as your false vocal cords. Next, where is glottis? Glottis is a place where the true vocal cords are present, which is also called as a rima glottidis. Next, subglottis is the inferior border of the glottis to the inferior border of the cricoid. Larynx is this is the epithelium part which we already talked about, right? So this is all you need to know regarding the larynx, guys. So thank you so much for watching my video. Goodbye.